Is the screen visible at YouTube?
Yes.
Not yet reached.
Yes, Father.
At YouTube? Not at, yes, reaching. Okay. Listening, this is from the official website of OET. Thank you, OET, for allowing me to use this for teaching purpose. Sample 2, listening part B, listening part B key skills. And okay. And as you know, the introduction is there in this part of the test. You will hear 6 different extracts. In each extract, you will hear people talking in a different healthcare setting. So keep all the settings, different settings written in your diary and all the connected vocabulary. That will help you. Now, for questions 25 to 30, choose the answer A, B, or C, which fits best. Not the right answer, which fits best according to what you hear, not from your medical knowledge. Don't use your medical knowledge. According to what you hear, you have to write the best answer. You'll have time to read each question before you listen. Time is given, golden seconds, 15 seconds are given to read the question. So just read before you listen. Yeah. Coming to, yes, question number 25. Now let's get into business. You hear an optometrist talking to a patient who is trying contact lenses for the first time. What is the patient concerned about? What are the hedging words? Please shout out or comment in the comment space.
Consensus.
Optometrist.
Yeah, optometrist who is
Optometrist.
talking to whom is very important. So, yes.
Contact lenses.
Contact lenses. Yeah, in what context they are speaking?
Patient concerned.
Patient concern.
Yeah, patient concerned. Yeah, patient concerned. Yeah, means concerned about what? So, here are 3 things. Blurred vision,
Soreness.
Soreness.
Soreness. Remove the lenses.
Remove.
Yeah, remove the lenses. How to remove lenses? Remove lenses. Okay. Okay, so let's listen to. Let me make it a bigger table. One sec. It's trouble me. Yeah. Yes, reaching out to bigger screen so that you can see better. Okay, listen. Okay, listen and identify the answer.
Now, you've had the lenses in for a few minutes. How are they feeling?
Not bad. I thought I'd feel them actually touching my eyes, that they'd be sore or prickly, but I can't feel much at all. My eyes do feel a bit watery, though.
It's okay. You've just used too much solution. Now, in a few minutes, I'll get you to try taking them out and inserting them again by yourself.
I had no trouble taking them out earlier, but I'm not confident about putting them in. I worry I'll press too hard.
That's unlikely to happen.
Things look rather distorted, though. I mean, I can't make out the letters on that chart.
Any of them?
Those lower down.
Let's give things another minute to settle down.
Okay. Which is the answer? Just type in the comment space fast. And if you can type in what synonymous word or expression was used there to identify that particular answer. Yeah, Ayomi, yeah. All are going for A. Oh, this, yeah, blurred vision, distorted. Oh, that's great. Yeah. A, watery. What is the, Ayomi, you are saying watery, but what is the answer? You haven't said what is the answer. Which is the option correct? Letter can't see on chart A. Okay, letter can't be seen on chart A. That's great, Malesh. That's right. Oh, Rebecca, yeah. Oh, everybody is sure it is A. Only one has said must be B. Soreness in his eyes. We'll check out. Two have said B. Okay, others all A. Martha logo distorted, exactly. Okay, let's check. Now, answer is blurred vision. Option A, all of you are right. Let's check with the audio, okay? Now listen and read and write. Try writing something. Take a notebook and pen. If you have two instruments, try to keep another instrument on so that you can watch the screen and listen. Attend the session from one instrument, the other instrument you can message and interact. I can give you 1 minute. So that, and also take a paper and pen and some snacks and some juice if you like to enjoy the learning journey. Okay. And keep smiling. Send me some smiling by the time others take the notebook, pen, because you need to do this multitasking. You have to listen and read at the same time, write something what you understand, the synonyms, synonymous language, answer, whatever. Okay. As you go on, I have highlighted something for you to understand. Are you ready? Give me a thumbs up if you are ready. Ready with your snacks, juice, notebook, pen, smile. Even if you don't take any other things, smile is compulsory, mandatory. Send me some smiles. I can't see you at the YouTube. You can send me smiles. At the Zoom, I can see them, but they are not smiling much. Yes. Right. Yeah. Right. Okay. Cool. Yes. So let's listen. Okay. Listen, read. This is going to be very challenging. This is a must stage for your practice competency. Don't take it light. Listen, read, and write together. Multitasking. 3 tasks together, which you have to do in the exam. Yes, we go here.
Now, you've had the lenses in for a few minutes. How are they feeling?
Not bad. I thought I'd feel them actually touching my eyes, that they'd be sore or prickly, but I can't feel much at all. My eyes do feel a bit watery, though.
It's okay. You've just used too much solution. Now, in a few minutes, I'll get you to try taking them out and inserting them again by yourself.
I had no trouble taking them out earlier, but I'm not confident about putting them in. I worry I'll press too hard.
That's unlikely to happen.
Things look rather distorted, though. I mean, I can't make out the letters on that chart.
Any of them?
Those lower down.
Let's give things another minute to settle down.
Yeah, smile at it, how nice it is, Yeah. It's blurred vision, and it says things look rather distorted. As I said, most of the answers will come from the mouth of the patient. So things look rather distorted. I mean, I can't make out the letters on that chart. Blurred vision. Again, I can't make out the letters on the chart. And so that also explains distorted vision, means blurred vision. And how to remove the lenses concerned about? No, patient said, I had no trouble taking them out. Means easy, I could take it out easy. That's not his concern at all. So it's just opposite. And sore eyes, but can't feel much at all. He says, no, it's not an issue. So that's simple and clean. Shall we proceed? Say yes and a smile.
Yes, sir.
Yes,
Yes, Father.
Yes, Father.
Yes. And last question, I'll be explaining with a different outlook, how to understand the one question, because all the questions it takes long time. So we'll explain in a new strategy, the last one. Yes, here you go. What are the things to be highlighted?
Nurse.
A nurse.
Okay,
Nurse.
asking a colleague for help with
Colleague.
it.
For help.
Yeah, yeah. Why
Father.
does? What is the reason? Why does the nurse need help?
Need help.
Patient's condition has deteriorated. I highlighted. The patient is worried about a procedure. And patient is reporting increased pain levels.
Increased pain levels.
Yeah, let's listen, okay? Whether the condition is deteriorated or the patient is worried about any procedure, or is some problem with pain level. What can the other nurse do if a patient has increased pain levels? Will you call the assistance of another nurse if you are working there?
No.
You will not call, like.
No.
Now, one nurse is asking colleague to help me for something.
Procedure.
Okay. Yeah, let's see. There is a presumption probably. Let's see whether it is right. But then C option, the patient is reporting increased pain level. You need not take all the patient nurses there or your colleagues. From general understanding, you can. Let's listen. Very easy. Smile and listen.
Kathy, could you help me with the patient in bed 103? The woman who had surgery 2 days ago.
Oh, yes, she's due for discharge today, isn't she? Does her pain relief need topping up again? I thought she wasn't very comfortable this morning.
Oh, she's on a reasonably low dose, but she's coping. She needs her chest drains removing, though, and she's got herself into a bit of a state.
Ah, well, that's a two-person job anyway, so I'll come with you. Has the consultant seen her? I know there was some concern yesterday about her condition and the level of the fluids draining into the bags.
Oh, he's cleared her for removal of them today, but I think some reassurance might be needed first.
Right. I might just check her analgesia and give her more before we go ahead.
Okay.
What is the answer? Type in the chat box, yeah, in the comment space. A or B or C. B. C is we have already eliminated. So the problem is between A and B. B, all are B's. I think I did not go on with the class because everybody knows exactly what it is. Right? All are answering right.
No.
No, you all are, see, everybody is typing in B, which means that just one listening, I did not explain anything. Okay, let's see. Come on, yes. B with a smile, yes, let's check. The patient is worried about a procedure. Okay, now listen. And, okay, I think, see now. Why? Deteriorated, the patient is worried about. Nurse asking a colleague for help with a patient due for discharge today. What does it say? The first option says the patient's condition has deteriorated, but here they say due for discharge today. If deteriorated, will they discharge?
No.
No.
Yeah. And again, she wasn't very comfortable this morning. I thought. That is not fact. I thought. But she is coping after the contrast word. The message is after the contrast word. But she is coping. She is coping means she is better. And now he has cleared her removal of them today. Okay. So all these things show that first option is not right. Okay. They are going to discharge the patient. Immediately, first option is eliminated. Third option is not given. That's also eliminated. Nothing about pain. And second is the right option. Is that clear?
Yes.
Yes, sir.
Yeah. And you will have to see here, when you listen, be mindful of this. Kathy, could you help me with the patient in bed 103? 103. 103.
And the patient who had surgery.
This is American English. 103 means 103. 10 OH. O. 103 means 103.
03.
Yeah, 103 means 103. So Americans say 103. They don't never say 0 or not 103, something of that sort. So they always say 103. Wherever there is 0, they say O. Okay. Almost like this OH. Yeah. Question 27. What is to be highlighted?
Voice talking senior nurse.
A senior nurse.
Okay, senior nurse talking about
What
a new
problem
initiative.
was intended to solve?
Yeah.
What problem?
About a new initiative.
New
Right?
initiative.
That's important. Yes. What problem was
What
intended to
problem?
solve? Problem. What problem? Okay, what problem intended to solve means in the future, right? Not solved,
Yes.
not the present, but in the future. They're intending to solve some problem. Just find out what is that they want to solve. Option A, patient's
Confusion.
confusion over
Confusion.
information given by the doctor.
Confusion.
Information given by the doctor.
By the doctor.
Doctor is relatives not being able to discuss issues with the doctor. Normally, when they have a
Relatives.
new initiative in the ward, it will be concerned about the doctors, relatives, or patients.
Patience.
Normally, right? In general sense, when they have introduced on her word, when she has introduced something on her word, the focus is patients, right?
Yes, Father.
About any initiative. Now, I'm telling you how you can scrutinize the questions. First one speaks about patient's confusion over information given by the doctor. Then relatives not being able to discuss issues with the doctor. Patients not discussing all their concerns when meeting the doctor. Let's listen. Listen now. Find out which is the answer.
One of our key priorities is improving communications between staff, patients and patients' families. We recently introduced a scheme called Dear Doctor, which involves giving each patient a card where they can make a note of any questions or concerns that they themselves have. They can also talk to their families during visiting time or even on the phone and see if there's anything else they'd like to add. The cards are then collected and given to the doctor before the ward round. We're really pleased with the response. Patients used to say that they only thought of the things they felt they needed to discuss when it was too late, so the cards give them a better chance to bring up whatever's on their minds. In fact, it's been so successful that we're going to roll it out on all wards in the hospital.
So type in what is the answer. Luvinda, yes, father, yeah, come on, C. Okay. Everybody says C, then why should I explain? Everybody knows it. C. Okay, let's check. C, yeah. Then help this with yes. Okay. Yes. Patients not discussing all their concerns when meeting the. Let's listen. Okay. Listen, read, and write.
One of our key priorities is improving communications between staff, patients and patients' families. We recently introduced a scheme called Dear Doctor, which involves giving each patient a card where they can make a note of any questions or concerns that they themselves have. They can also talk to their families during visiting time or even on the phone and see if there's anything else they'd like to add. The cards are then collected and given to the doctor before the ward round. We're really pleased with the response. Patients used to say that they only thought of the things they felt they needed to discuss when it was too late, so the cards give them a better chance to bring up whatever's on their minds. In fact, it's been so successful that we're going to roll it out on all wards in the hospital.
See? Improving communications between staff, patients, and patients' families. That is the topic sentence and the topic of the paragraph. A scheme called Dear Doctor. Dear Doctor means patient has to call Dear Doctor. Involves giving each patient a card where they can make a note of any questions or concerns. Then family's concerns. Then really pleased with the response. Cards give them a better chance to bring up whatever is on their minds. Patients used to say they only thought of the things they felt they needed to discuss when it was too late. So this is called gist questions. And the gist meaning is, overall meaning is that, do they say patient's confusion over information given by the doctor? They don't speak anything about information given by the doctor. Relatives not being able to discuss issues with the doctor, it's not mentioned at all. It says only the family members. You can contact the family members over the phone or when they visit and add if something is to be added in the card, if they want to communicate something to the doctor. Is that clear?
Yes, Father.
Yes, Father.
Yes,
Father.
yeah, except
Yes,
one,
Father.
everybody has said she, so you know. So cool. Question 28. Let's check. You hear two radiologists talking about the type of scan to be given to a patient. They agree to choose the method which will, option A, allow them to see the whole of the appendix. B, probably give the most accurate results. C, have the fewest risks for the patient. So, what is to be highlighted?
Two radiologists, type of scan,
Okay, two radiologists.
Agree.
Agree.
agreed to choose the method.
Yeah, agree. Yes. Agree to choose the method or agree, whatever you want to highlight. Yes. Now tell me, now from your general knowledge, what will be allow them to see the whole of the appendix? Probably give the most accurate results. Have the fewest risks for the patient. What will be the concern when you prescribe something?
Risk.
Result.
Patient safety.
Patient safety, yeah. So, fewest risks. Then let's highlight, let's see, check what is the second one, probably give a most accurate results.
Accurate
Okay,
result.
accurate results or results to see whole of the appendix. So appendix, results and risks. Listen now, okay, which is right. Yeah.
I've just had a phone call from emergency. They have an 11-year-old boy with right lower quadrant abdominal pain. They're concerned about appendicitis and they'd like to order an abdominal CT for him.
Do you think that's a good idea?
I was thinking maybe we should recommend an abdominal ultrasound because then we can spare him the radiation.
Is there any concern in this case around using ultrasound instead of CT? Accuracy, for example.
The sensitivity is slightly less than the CT, but the specificity is almost the same, so I think we can rely on the results.
Okay. It means we can avoid the child being subject to contrast exposure as well. But what would we do if the ultrasound doesn't answer the question?
If we can't visualise the complete appendix, then we can recommend an abdominal CT.
Okay, we have a plan. Call them back and let them know.
Okay, type in the answer and any synonyms or synonymous expression that tells you that is answer. Yeah. PSG, CC. Yes, C. Everybody is for C. So all are supposed to get 500 out of 500, I believe. Everybody is right. Okay. Yes, all have got the right answer. Let's check. Okay. Give the fewest risks for the patient. Listen now. Okay. Yes. Listen, read, and write. Okay. By then it will be clarified.
I've just had a phone call from emergency. They have an 11-year-old boy with right lower quadrant abdominal pain. They're concerned about appendicitis and they'd like to order an abdominal CT for him.
Do you think that's a good idea?
I was thinking maybe we should recommend an abdominal ultrasound because then we can spare him the radiation.
Is there any concern in this case around using ultrasound instead of CT? Accuracy, for example.
The sensitivity is slightly less than the CT, but the specificity is almost the same, so I think we can rely on the results.
Okay. It means we can avoid the child being subject to contrast exposure as well. But what would we do if the ultrasound doesn't answer the question?
If we can't visualise the complete appendix, then we can recommend an abdominal CT.
Okay, we have a plan. Call them back and let them know.
Yes, see the all of appendix first option. If we can't visualize the complete appendix, that is not even discussed, a proposal kept. Okay, what do they agree? See, we can spare him the radiation. Female voice says we can spare him the radiation. Male voice says we can avoid the child being subject to contrast exposure. Same thing, right? So they agree on that. I think we can rely on the results. It also says that is cool. Male and female agreeing with the same expression. See, paraphrasing, we can spare him the radiation, and here we can avoid the child being subject to contrast exposure. Okay, that is clear. Let's move on. Question 29. So tell me, what are the things to be highlighted? You hear part of a surgical team's briefing. The male surgeon suggests that the patient could, option A, require specialist equipment during surgery. Option B, benefit from a specific anesthetic procedure. Option C, be at risk of complications from another health issue. What is to be highlighted? Heading words or keywords or phrases in the question?
Surgical team.
Okay. Surgical
Male
team.
Suggest male
Surgeon
surgeon
Yeah,
suggest.
suggestion.
Suggest.
Suggestion by someone. Okay.
Equipment.
In option A,
Specialist
equipment or
Equipment.
specialist equipment. Okay.
Anesthetic procedures.
Anesthetic procedure. Okay. Anesthetic procedure.
Other
Complications.
Complications. Okay. Complications. You are experts in identifying the hedging words. Cool. Now let's listen and find out the answer.
Okay, next is Mr. Malloy's repeat laparotomy. Any anaesthesia issues?
We don't expect any particular problems. He's relatively fit and well, except for his epilepsy, which is under good control. His BMI is 35, but
Will we need the obesity bed?
it shouldn't be an issue.
And what about the epilepsy post-operative management?
He's taking his oral medications, and we can use an IV if necessary.
I know he was in a lot of discomfort after his last surgery, and this time he's going to need a larger midline incision. It may be worth thinking about an epidural. He's certainly at the extremely low edge in terms of pain threshold.
So type in what's the answer in the comment space. Yes, B, B. B, 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 B. Come on, type in fast. Yes. Yes, all are for B. Okay. Benefit from a specific anesthetic procedure. Let's listen.
Okay, next is Mr. Malloy's repeat laparotomy. Any anaesthesia issues?
We don't expect any particular problems. He's relatively fit and well, except for his epilepsy, which is under good control. His BMI is 35, but
Will we need the obesity bed?
it shouldn't be an issue.
And what about the epilepsy post-operative management?
He's taking his oral medications, and we can use an IV if necessary.
I know he was in a lot of discomfort after his last surgery, and this time he's going to need a larger midline incision. It may be worth thinking about an epidural. He's certainly at the extremely low edge in terms of pain threshold.
Yeah, to select the second answer, is there any synonyms or synonymous expression?
Yes, what?
What is it?
Consider epidural. Consider an
Epidural.
epidural due to
Yeah, it may be
Not
worth thinking
painful.
about an epidural. He is certainly at the extremely low edge in terms of pain threshold. See here, the male surgeon suggests. That's why we have highlighted it. So should you concentrate on female?
no.
No.
No, till the end, last portion, female is answering. Then last, male suggests. So that's why we have the male surgeon suggests highlighted. There is a focus. So your answer is damn sure comes from the male. Until then, male was only asking questions. Okay, answers were given by female. So nice and sweet. I think no more EduSkills should not keep continuing teaching because everybody is an expert. Why should I? Like, cool. Let's go to question 30. We are going in a bit deep in this, okay? I'll give you a way of analyzing the text. If there are beginners, that will be beneficial for you. It will take some time. Yeah, now let's see what is to be highlighted.
Introducing interprofessional primary health.
Okay, care teams. Okay, cool. Then what hasn't been established about the teams yet?
Yet.
What has not been established?
Established.
Negative.
Has
Okay.
not been established.
Yes,
Negative
talking about
expression.
about the teams yet. Okay, first option A, the best way for collaboration to take place.
Collaboration.
B, option B, the financial impact that they are likely to have. see the aspects of medical care they are best suited to. A, the best way for
Collaboration.
Collaboration.
Okay.
Financial
Second one,
impact.
Financial
Financial impact.
Okay. Third one,
Medical
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 care.
care.
Medical care they are best suited to. Listen now, okay? Let's listen and enjoy the last one.
We're looking at opportunities to improve the effectiveness of health and healthcare systems here in Canada. One of the interventions we're looking at is interprofessional primary care teams, groups of professionals working together collaboratively to provide services including healthcare, social services, and advice to patients within the primary care setting. There's evidence that teams like these can improve chronic disease outcomes, including diabetes, hypertension, and heart disease, as well as mental health problems. There's also evidence that improvements can be made in terms of both access to and coordination of care. Now, the extent to which these teams could affect the costs of healthcare in such areas isn't quite clear within the evidence, but the work we're doing aims to address such issues while looking at the challenges of implementation and evaluation.
So type in what is the answer? Already answers are there. B, 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 B. Yes, all B's. All B's. Type in B's with a smile. B's with a smile. Yes, B's, B's, yes. Good. All are right. Don't require any explanation. Benefit from a specific and sorry, that was not the thing. See now, let's listen, okay? Listen, read, and circle, write down whatever you want to. Try focus on the structure, okay? Try to focus on the structure of the paragraph as you listen now.
We're looking at opportunities to improve the effectiveness of health and healthcare systems here in Canada. One of the interventions we're looking at is interprofessional primary care teams, groups of professionals working together collaboratively to provide services including healthcare, social services, and advice to patients within the primary care setting. There's evidence that teams like these can improve chronic disease outcomes, including diabetes, hypertension, and heart disease, as well as mental health problems. There's also evidence that improvements can be made in terms of both access to and coordination of care. Now, the extent to which these teams could affect the costs of healthcare in such areas isn't quite clear within the evidence, but the work we're doing aims to address such issues while looking at the challenges of implementation and evaluation.
Okay. How did you find out? What are the synonyms used for option B?
Healthcare in such areas is not quite clear.
Okay. The extent to which these teams could affect the costs of healthcare, financial impact. Cost means financial impact in option C. And also when there is a time expression or chronological expression, that's a clue, there is an answer, right? Now, is the time expression given. That's also, let's look at maybe the structure now. Okay. Now, how to summarize this? See, this we are looking at opportunities to improve the effectiveness of health and healthcare systems here in Canada. Topic sentence, that is the topic of the paragraph. What is the topic? Improve the effectiveness of health and healthcare systems. And for which we have the supporting sentence. One of the interventions we are looking at is interprofessional primary care teams, groups of professionals working together collaboratively. So supporting sentence says how to improve the effectiveness. Okay. Topic says improve the effectiveness of health and healthcare systems. So our question is how? Supporting sentence, second sentence says interprofessional primary care teams. Okay. Then what is the purpose? To provide healthcare, social services, and advice to patients. To provide services including healthcare, social services, and advice to patients within the primary care. Then next is benefits. What are the benefits of having this particular professional primary care team. Option C says the aspects of medical care they are best suited to. Okay, benefits 1, improve chronic disease outcomes and mental health problems. Benefit 2, improvements in terms of both access to and coordination of care. Okay, now disadvantage. These are 2 benefits given, then they are giving disadvantage. Costs of healthcare in such areas isn't quite clear. See how they have put. First they said there is some issue now. We are working on something. What is it? Then what is the solution we have found out? The team, interprofessional primary care teams. Then what is the purpose of this particular team? And what are the benefits of having a team like this? Then what is the disadvantages or disadvantage of having such team? Now you see, structure is this topic sentence. Supporting sentence 1 says how, support, and then it says what is the purpose of this team. Supporting sentence 2 speaks about benefits. Then developing sentence 1 says benefit 1. Developing sentence 2 says benefit 2. Then supporting sentence 3 speaks about disadvantage. Okay. What is the topic? Goal. What is the goal? How to achieve the goal? What is the purpose? Then what are the benefits? Benefit 1, benefit 2. Then what are the disadvantages? Okay. That is the structure. Now, the topic is improve the effectiveness of health and healthcare systems. How? Interprofessional primary care teams. Then purpose to provide healthcare. This particular team will provide healthcare, social services, and advice to patients. Benefits. C option says the aspects of medical care they are best suited to. Benefit, improve chronic disease outcomes and mental health problems. Benefit 2, improvements in terms of both access to and coordination of care. Disadvantage, costs of healthcare in such areas isn't quite clear. Option B, which is the right answer, says the financial impact that they are likely to have. So that is it. And coming to let's read this once again. Yeah, here. So you can give me escape. See, while reading, you start here. We are looking at opportunities to improve the effectiveness of healthcare systems here in Canada. One of the interventions we are looking at is interprofessional primary care teams. After this, okay, semicolon, you have the explanation, which if at all you don't understand, such things can be ignored. They can be ignored. See, without that also, this primary care teams, the semicolon tells what comes next, speaks about the complements about that particular primary care team. There's evidence that teams like these can improve chronic disease outcomes, including it's all chronic disease. They are explaining chronic disease. So that also can be ignored to make your understanding easier. So you can read there is evidence that teams like this can improve chronic disease outcomes as well as mental health problems. There's also evidence that improvements can be made in terms of both access to and coordination of care. See, first option is what hasn't been established about the team's health. First option says the best way of collaboration is not established, but the text says it is established, right? There is evidence. Where is it? Yeah. See, there is evidence. Coordination. There is evidence about the coordination and care. So, this is first option is opposite. The aspects of medical care they are best suited to. Again, that is also given here in terms of access to and coordination. Access to medical care. So, B is the right answer. Is that cool?
Yes, Father.
Yes, Father.
Yes, Father.
Yeah, so easy, yes.
Yes, sir.
That's it, 6 questions. We have run fast today. You're all experts, so I did not use all the slides. I just jumped from slide to slide because you are all getting the answers. It's as simple, all the questions are in the same way. Okay, so thank you. Let me stop sharing. If you have any concerns, you can discuss this.
Hello, Father.
Yes.
This is Savita. Savita,
Yeah,
Father.
one sec. Let me, yeah. Oh, yeah. Let me reach out.
As you
Yeah.
said, we are become so expert because of you. The credit goes to you, Father. We are coming to learn, Father. We are learners. We are learning because of your strategies and the way you are taught us. That is very much helping, Father. It's very, very, very nice. No one taught like this before. I have also attended many more institution before, but never taught the way you taught us. So thank you so much, Father.
You're welcome. Share it to others. That's what we want. We have to reach out to everyone. Recently, I saw some video which was claiming somebody has become a health professional, has become millionaire by teaching others. OET. Millionaire. Yes. People can claim that publicly, yes. Did you see that video? No.
Oh, Father.
Okay. There is a video which claims that one particular nurse who started teaching OET has become a millionaire now. They themselves have put. Yes. Yes. Any concerns? Any suggestions for the next sessions?
Father,
Yeah.
Father, I'm Iomi, and
Yeah.
I would like to say that actually we can predict the answer in the most of the questions without listening to the audio. That's
Yeah.
just because of you, Father. Thank you so much.
Okay. It's not because of me, because of OET. They have given such easy questions where you can predict before you go to the text.
But you gave us a lot of strategies to find the answer
Yeah.
and predict the answer.
Yeah, it's also because of your consistent practice. We give strategies, but people go into institutes, from institutes to institutes, spend lakhs of rupees, don't want to practice consistently. Yes, Father, she said absolutely correct. Manjushabu is saying you are absolutely, Iomi is absolutely correct. What our concern is, let's reach out to maximum people. If you all try, definitely we can. Why don't you try? Why don't you send these links to others so that when you are spending this time, it can be useful for maximum people? Okay. And again, maybe one presumption is that you can watch in the YouTube channel later recording, but that will not be effective, I tell you. See, even Zoom sessions are not that effective as real classroom sessions. If real classroom sessions are 90% effective, Zoom session can be 70% effective. And watching the recording can be 40 to 50% effective, that's all. When you listen directly, interact with and learn, that's most effective. And also you concentrate better when you are in a live classroom, right? Then you listen passively to the audio. Those are that way. And you are not accustomed to that type of learning, listening to videos and learning. You have been trained in real classrooms, right? Thank you, Father. I really don't get the part we and she, though others were very fast and good with the answers. I was a bit confused, but I am getting it better now. Yeah, definitely. Maybe others have practiced for a longer time. You are just starting your practice. Practice means strategical practice. Using the strategies you have to practice with patience, definitely you can. And listening and reading, definitely you can score 450 plus, no issues at all. Because all the questions are same. You take any question, the booklet, authentic material, same strategies are being used. If there are some 10 to 12 strategies, that's the only thing they use in all the reading materials. Maybe in one material, they will use 6 strategies or 8 strategies or 9 strategies. Another one, another 6 strategies or 7 strategies. But then the same strategies. Yes.
Hello, Father.
Yeah, please.
Father, I would like to say one more thing, Father.
Yeah, please.
Actually, whenever I started watching your YouTube video, Father, you already said that no one need to your correction. I thought that time, that is possible. So now I became, and I made myself father. I took a 1 mock before only watching your videos, and now I'm participating daily sessions, and I'm trying to do the things how you taught us. So this is my result, father. It's 35, 36 I'm getting nowadays. So I definitely say that we can improve. We can.
Definitely, yes. Congratulations. Go on.
Thank you so much, father. Thank you.
Anyone else? Any sharing? Any concerns? Yes. Any concerns? No smiles? At Zoom? Smile is very expensive, right? Yes. You all have to purposely bring in smile, but I feel smiling without any efforts. Yeah. Aisha Kuram, you'll be disqualified. No signature, no smile. Every time I am reminding you. Yeah. Good. Yes. Any other concerns? You can post in. And we'll have probably Saturdays we'll check out. I have some program outside on Friday, but if I reach back, we'll have Saturday. But stay tuned to the notices. And Monday, definitely live sessions are permanently there. And we'll be starting the new batch of full-timers. Majority